Most patients believe their surgeons get paid thousands, sometimes tens of thousands, for major surgery. Let me share with you a recent example from my practice. Hi, I'm Tyler Goldberg, orthopedic surgeon and founder of NAOCA. And a few years ago, I realized something uncomfortable. The system we're practicing in is a game doctors can't win. More volume, more patients, more burnout. So in 2023, I flipped the script. I rebuilt my practice around a different model, one where the surgeon controls the care, the patient experience improves, and the economics finally work. That decision transformed my practice and my life. Now I help other surgeons learn and how to do the same thing. So let me get back to the story. I've been taking care of patients since 2016 who had a knee replacement, and he had a complication, right? He actually came to my office 6 weeks post-op. He's getting out of his van, his foot wraps around the seat belt, and boom, out he comes, impaling his knee into the pavement of my parking lot at my office. Knee splits open, of course, and we're in surgery that day. And over the years, we've attempted multiple salvage procedures, washouts, revisions, debridements, falls, chronic drainage. All in, the patient probably had 15 to 20 operations on that same leg, me trying to save it. Eventually, we had to make one of the hardest decisions there is in orthopedics, an above-knee amputation. Now, for those outside of surgery, this isn't a simple operation. After years of infection, prior procedures, the anatomy is totally distorted, the tissue quality is terrible, and the emotional weight of the moment is enormous for both the patient and the surgeon, I might add. The insurance reimbursement for that surgery, that took hours, by the way, $425.83. That night, the patient began hemorrhaging and went into hemorrhagic and septic shock. In the ICU, I took him back to the OR emergently in the middle of the night to control the bleeding and save his life. Reimbursement for that surgery, $213.30. Total surgeon payment for both operations, right about $600. What's fascinating is the patient believes I was paid over $10,000. Not because he's naive, but because that's what the hospital bill makes it look like. Patients see a bill of $40,000 to $80,000 from the hospital and understandably assume the surgeon receives most of it. In reality, the surgeon portion is just a tiny fraction of that total healthcare spend. This isn't a complaint. I would take care of this patient again every single time. I know him like family. I've seen him so many times. But if we're going to have an honest conversation about healthcare economics, we need to acknowledge the massive disconnect between perception and reality.